to
Diane?
see what's going on in the meeting, or do we need to access it from another device?
All right, good morning. We're going to start our press conference today. We're virtual, as you can tell. We are streaming the meeting, as well as we've got virtual call-in from several of our guests this morning. I am joined live by Dr. Remington, and virtually City Councilman Mike Clondaris and Kirk Carlson from the Bowen Center will be talking today. So I just want to go through a little bit of where we're at today. Today last Friday we called a hastily arranged press conference. Okay, can I ask you all that are on virtually to mute, please? All right, thank you. So again, last Friday we called a hastily arranged press conference to raise the level of community awareness as to the increase of the COVID-19 last week. I think today we're issuing a much higher level of concern and plea to follow safety precautions to help prevent spread. So let's take a look at the numbers. 1 month ago, October 13th, and this is from the state standpoint, our daily case count was 1,151. 3 weeks later, which was last week, the number of new cases in the state hit 4,000 for the first time. Since last Friday, the number of new daily cases in the state Wednesday, hit 6,654. So in the month, our daily cases have gone from 1,151 to 4,000 to 6,654 cases daily. The 7-day positivity rate is 10.5% in the state. And as you'll hear in a moment when Dr. Remington updates us, just reported this morning there was a new daily record in Kosciuszko County of 104 cases. So let's take a switch and look at the demographics here. This is something that was stunning to me as I looked at it this morning. This is the last 30 days in the state, and this just shows on the left side the demographic, in other words, the age groups that are being impacted that are testing positive for the coronavirus, for the COVID-19. And by my math, 77% of those under the age of 60 are affected by the virus. 77%. The rest are over the age of 60. So when we look at the death rate and we look at the demographics for death in the last 30 days, 92% of the deaths are over 60.
It started, so I'm watching it on my phone.
Sorry about that. So what the point we're trying to make is that the death rate is impacting those over 60. That 92% of those that have died from COVID in the last 30 days are over the age of 60. And those that are spreading the disease are under 60. 77% of the cases are under the age of 60. I think that's compelling. Again, I think it's a logical conclusion that 77% of those under the age of 60 are spreading the disease to the older population that are being hospitalized and dying. So I hear people say that they're not concerned about getting or spreading the disease. The symptoms are mild. I don't care about catching it. I'm going to be fine. But if we look at the science, the hospitals are filling up. and people are dying as a direct result of the uncontrolled community spread that is occurring. We've seen a dramatic shift in the map colors. It has been painted almost totally orange, and I fear that we're heading towards the red. So let's talk a little bit about masking and precautions. The CDC updated a literature search this past Tuesday regarding the use of cloth masks to both block exhaled virus and filter airborne droplets to protect the wearer. The literature search highlighted 7 studies that have confirmed the benefit of community use of cloth masks. And I want to read the conclusions to you. Experimental and epidemiological data support community masking to reduce the spread of SARS-CoV-2. The prevention benefit of masking is derived from the combination of source control and personal protection for the mask wearer. The relationship between source control and personal protection is likely complementary and possibly synergistic, so that individual benefit increases with increasing community mask use. Further research is needed to expand the evidence base for the protective effect of cloth masks, and in particular to identify the combinations of materials that maximize both their blocking and filtering effectiveness, as well as fit, comfort, durability, and consumer appeal. Adopting universal masking policies can help avert future lockdowns, especially if combined with other non-pharmaceutical interventions, such as social distancing, hand hygiene, and adequate ventilation. So the point is, studies have been gathered, collated, reviewed, and there is a definite up to most mentions at least a 70% reduction in possible spread through these 7 early studies. And certainly more studies are needed, but the evidence seems to be clear that community masking is a simple way to take care of this problem. So let's go back to locally, our reaction, what we are doing, what the city is going to do locally with this most recent increase. So again, given the new record of number of positive dailies and our positivity rate approaching the red status of greater than 15%, and our concern with the approaching flu and holiday season, the gathering season, the city is taking the precautions for the health and safety of our employees. As of Monday, November 16th, with one exception that I'll mention in a moment, all city buildings, including City Hall, will remain open, but in-person business by appointment only until further notice. So again, business will continue digitally, website, email, postal mail, as usual. In-person meetings for specific city matters will be available by appointment at designated locations in the building that can be sanitized and controlled as needed. Public meetings will be available virtually to the public and press until further notice. Board members will have the option to attend in person or virtually. The city just upgraded our sound system and video capabilities to provide better audio and video streaming quality for virtual meetings. We are now using those improvements. As mentioned, the exception to the in-person appointment access to our building will be Monday night. We have a public hearing already scheduled for our council meeting. In-person attendance at the meeting will be allowed to accommodate those wishing to comment at the public hearing. We will also make available a phone number to call in for those who wish to comment virtually, similar to what we did in the last rate hearing. Yesterday, I signed an executive order establishing a pandemic telework policy. As of Monday, November 16th, to the end of the year, on a case-by-case basis, if practical, our employees may be allowed to work from home and be paid for circumstances related to the protection of their health. So, in summary, we take seriously our responsibility to continue to provide uninterrupted services to our city in the midst of this significant surge in cases. The restrictions I've just discussed are tools we need to meet that responsibility. We will be carefully watching the situation and make further adjustments as necessary. Dr. Remington will make remarks now with regards to our local status, and will also discuss potential controls, community controls that we may find necessary to implement. Dr. Remington.
Sure, thanks, Mayor. The last 3 weeks have been phenomenal with our experience with the pandemic. We had lumbered along with ebbs and flows in the last 6 months, but this last 3 weeks has been really surprising and sobering. I'm hearing more voices in my ear from hospitals and hospital providers of health care that are very anxious, painting a very dire story, quite frankly. People showing up in an emergency room with chest pain may not have quite the same accommodation of care and the level of care as they would have traditionally received a month ago. There is such consumption of healthcare resources, whether it be personnel, physical space, bed capacity, access to procedures. It is so compromised by COVID that routine care is starting to feel it. Your future care could be compromised. I want to emphasize that. We are on a trajectory that is very, very worrisome. Exponential growth of cases. We have seen substantial growth, as the mayor mentioned, locally. Our county statistics are very sobering. We are now up over 3,000 cases, a 74% increase through the month of October till now. Yesterday, we set a new record. It was actually 154 new cases, which was a record. In District 2...
I can see you. Can you see me? Nod your head if you do.
District 2...
Can you hear me?
Mm-hmm. District 2, which is South Bend, St. Joe, Elkhart County, and our county, 50% of the ICU bed capacity is consumed by COVID cases, half of the ICU capacity. Schools are increasingly compromised, not so much by a burden of sick kids filling up a classroom, but from the burden of isolation and quarantine, taking out not only students, but the staff, the teachers, the people that a school needs to pull their day off. So I want to paint the picture that it's not simply more testing. It's not simply more cases. There is a clinical weight to this, and it could impact your future access to services. So now really is the time to pivot into a new paradigm of interventions or strength of interventions. The governor's press briefing on Wednesday, I think, was very careful in trying to thread that needle for our state. As I'm sure you know, we are leaving stage 5 through his executive order, and we'll be moving into a new model, a county-by-county color-coded map approach to targeted interventions. We are in an orange county today. We could easily tip into a red county in the next week or two. And for those business owners out there, I want you to hear that. I want you to look at the restrictions that a red county will be faced with, because I think we're heading there. Masking has good evidence behind it. I can't say that enough, and thank you for bringing up that recent piece of science that further emphasizes the role of masking. Masking is not perfect, but it's so cheap, so available, if people would just be willing to put one on. Masking works. Social distancing works. It does. Although there are exceptions to that. Forceful cough, sneeze, and maybe that 6-foot thing that we say is not so accurate. But at least try to comply with that social distancing motif of the 6-foot radius. I would ask for restaurants and bars to look at this. There will probably be some more strong-armed, I would suggest, enforcement coming your way from the health department. All it takes is a resident complaint to drive us to look at the situation. We will try to work with every business, every restaurant, every organization as closely as we can to try to steer you in the right direction. But there will be times when we will look more strong-armed than what we have been. So please comply with these general public health guidance. We just don't have, to say it again, many arrows in our quiver. We've got to try these. Masking, social distancing, avoiding crowds, rethinking any planning of a social gathering. Stay home if you're ill. Please stay home if you're ill. Testing will help us discern who has COVID, who doesn't. It's not perfect. We have been able to ramp up substantially testing access in our county, but despite that, you will see long queues for any testing venue. On a hopeful side, Eli Lilly, as you may have heard, has a monoclonal antibody product that has FDA approval, just announced this week. There'll be issues with accessibility to that limited product, and it will be applied to outpatients. These are people not as ill as the traditional inpatient cohort of people. So we'll all be standing eager to see how this will work, but it's a very promising intervention. It is an intravenous infusion, a single trip to an IV infusion site somewhere. All the details yet to be worked out, but it be likely reserved for those who are most compromised by chronic health conditions or age. And I believe will require a positive test to confirm a COVID case before an infusion is offered. Many details yet to be worked out, but that is a very hopeful therapeutic right at our doorstep here. Immunization is coming. The Pfizer vaccine, I think, will be the first coming one, probably in a matter of the next few weeks, to certain healthcare hospital venues. It will be offered to frontline workers, probably in COVID units or nursing homes, that kind of thing. We hope to have more accessible vaccine to the general public in the months ahead, but at least we have vaccine coming, and the Pfizer product looks very promising. So we can get through this. It is really tough right now, and we just need voluntary citizens to be good citizens. We have opportunities to be more strong-armed from our local health department, and we're willing to take that. We would much rather engage with willing and eager citizens trying to find the right strategy for their particular venue. Thank you, Mayor.
All right, thank you. Joining us also today is Councilman Mike Klonderis, who will be having a discussion or reading a statement on behalf of the council. Mike, welcome. Sorry about our technical glitches. I saw you panicking online, but you're here now, so you can go ahead.
What's the old saying? You can't live with them, can't live without them.
That's
That's
right.
Technology, right?
Right.
Thank you, Mayor. Thank you, Dr. Remington. I'd like to piggyback off of what you just said about being good citizens. I've had discussion with my fellow councilmen and women, And we are concerned. With their blessing, I've put together a statement. I'd like to read it. So here goes. Due to the ever-increasing number of positive coronavirus cases in our community, with one exception, a majority of the Warsaw City Common Council would kindly ask everyone who can to please mask up. By doing so, we can hopefully keep our schools safely open, help support, maintain, and keep our local businesses open, prevent our local healthcare providers from hospitals to emergency services from becoming overwhelmed and overburdened, and hopefully save local lives. This is not intended as a political statement and should not be taken as one. It is simply a public health safety request. Won't you please help? The life you save may be your own or someone you care about. And that's the end. I would like to, on a personal note, being a self-proclaimed news junkie and student of history, I think it's worth noting that on our current trajectory in this country, the CDC has just recently in the last 1 or 2 days is projecting that by March the 1st, if we keep going the way we are, we're going to have 438,941 deaths in our country. To put that in some kind of perspective, and this is where my history background comes in, total United States deaths in World War II was 20,000 less, at 418,500. And that includes both military and civilian. So I hope that can soak in a little bit to people that we are on a roller coaster with no brakes. And everyone needs to do their civic duty. I know people are concerned about their rights, and we all have rights. But I think we need to show some human compassion and some social responsibility and try to take care of each other, because we're all we have. I mean, my whole family, we are not going anywhere for Thanksgiving. I've told my kids who are overseas, stay home. We're not going to anyone's house. Simply because I want to be able to enjoy Thanksgiving with them next year. So please mask up. Hopefully by doing so, we can save lives and save some of our local businesses. Thank you, Mayor.
All right, Michael, thank you, and I certainly appreciate you expressing the sentiments of the council. This is obviously what we've been talking about from day one, to be quite frank with you. And I think we've hit a point where we all need to take this as serious as we can, because as Dr. Remington said, there's a little bit of a storm potentially on the horizon, and if there's ever a time that we need to act, it's now. Speaking of masks, I did get notified this morning that there's an ample supply of masks at Fire Station number 2. Ann Sweet and her group and other organizations have been providing masks for the public. So if you need a mask, they'll be provided free of charge. Again, I've heard there's ample supply, so it might be a good time to grab masks for your family and friends. That being said, we did have a little bit of a technical issue this morning here, and I'm having our news reporters text their questions in. And the first question was from Dave Sloan at the Times-Union, and I think it's addressed to Dr. Remington, but I'd be happy to weigh in as well. What kind of strong-armed enforcement can restaurants expect? Expound more on expectation for restaurants.
Well, the ultimate step, of course, that the health department can take and has been taking around the state depending on the department, is pulling a food license. That is not our desire ever over these kinds of issues. We'd much rather work with you, but understood that if we are serving a complaint from a citizen and we enter your premise and you are unwilling to work with us, we have that ultimate action. We can pull a food license. Thank you.
So I've had some discussions with restaurateurs yesterday specifically about that. Dr. Remington and I were on a call earlier this week with Dr. Box, with those in District 2, hospital officials, public health officials, elected officials, talking about these concerns. I was on a call yesterday with 70-some mayors in the state of Indiana, again, talking about these issues. And enforcement is obviously a question on everyone's mind. I know that the health department certainly wants the support of the locally elected officials should they decide to enforce. The hospitals were pretty vocal about their desire for locally elected officials to get behind the enforcement because of the difficulties the hospitals are seeing right now. Some of them are at capacity. A lot of them are filling up and getting close to that. So I think the hospitals, those that are on the front lines, are feeling this the most right now, and they're desirous of some type of action. So the discussion that I had and what we listened to yesterday with the mayors and other groups, with that group Monday night, the state wants the locals to basically enforce, and if more restrictive measures are required because of local conditions, that local governments and primarily the health departments are empowered to do that. I feel like in this county we've done a very good job to this point. What's happening here is happening all over the state, all over the Midwest, all over the country. And we are trying to respond the best way we can, the most effective way we can. And I think to Dr. Remington's point that discussion with our business owners to require masks for entry and to enforce masks within the premises of their building is important. And that would bleed over to me to the restaurants as well. With that, the social distancing requirements that have been around since we started this, the 6-foot distances, I think, to my mind, the restaurants that I've talked to, they feel like the 6-foot distance between tables is doable. And again, I think they understand the importance of the ramifications of where we're at now. And if this continues as it is, if we continue to go up 1,000 cases a day in the state for the next few weeks, the hospitals will be overrun, and we'll be in a world of hurt. So I think the important thing here is that all the businesses, all local businesses, should take on the responsibility to control and to enforce within their businesses, and we're asking that the masking is an important part of these precautions and restrictions, and we ask that businesses enforce that within their businesses. And I think we ask that restaurants try and keep their social distancing and mask wearing a part of what they're doing right now. I know other communities are issuing restrictions. I know Indianapolis is down to 50% capacity in restaurants. I believe they're no karaoke, and I think they've closed sitting at the bar, but there are local health departments that are making these decisions locally, and I think our message all along from day one is to continue to practice these safe measures and vehemently ask that people, vehemently may not be the right word, but just ask that people wear masks when they're in businesses, and ask those business owners to enforce those things. There's nothing further we can do without some type of direct enforcement action, which I don't believe is necessary. I don't believe it would be effective. I think hopefully the numbers that we spoke about earlier, the rapid rise in the number of cases, the increase in death rate amongst our seniors, and the vast community spread that's occurring within all age groups. I believe the 20 to 29-year-old age group, 20% of the new cases the last 30 days have been that age group. So this is a disease that's obviously hitting everybody and being spread by everyone. So I think we're beyond the point of beating somebody over the head with a club and telling them to wear a mask. I just have to believe that responsibility is so critical at a time now more than ever, that we're asking restaurants to comply with masking and with social distancing within their establishments. So I heard a few more questions. From Dan Spalding, will Dr. Remington limit his own family interactions on Thanksgiving?
Already have changed plans. We were going to celebrate this weekend, and we unraveled that and celebrate again in a couple weeks or a week, and we're going to unravel that too. So yes.
All right. Let's see. I'm going to call Kurt Carlson. Again, we've had a little hiccup here. Kurt is out at the Bowen Center handling the testing, and I'm going to have him put him on speakerphone, and hopefully you can hear him. Kurt?
Hey, hello, Mayor.
Hi, I'm just going to put you up the microphone and let you talk about testing, and you're on.
Okay, am I on now?
Yes, sir.
Okay, well, this has been an interesting set of challenges, and I think we've overcome them all. So let me just sort of say where we've been and where we are now. So the first week, we've been open just about a month. The first week, we did 328 people. The second week, it was 741 got tested. The following week was 1,032, and this past week was 1,413. So it's going up exponentially. Not only are more people aware of it, but we also have the influence of the surge, and now we're finding that employers and schools, they're requiring their employees to get tested sometimes as much as weekly. So that's contributing to the numbers, but it's certainly a privilege to serve. We're pretty much fully staffed now. It's taken a while to recruit a number of bilingual, bicultural individuals to be able to work in the booth. I've been using additional staff from around the center to make sure that we've had enough people to run the test site. And the Hispanic Coalition has been very generous about providing us people over the last few weeks. And I think we're at a point now where we can handle that with without needing to call on the Hispanic Coalition. But we very much appreciated their support and the persons who have come to us from there. Our current biggest challenge is the supply of the test kits. The state had made predictions about the number of tests that would be done in each site each week, and I think the state is far in excess of what the state had originally planned for. And so I think they're trying to step up, knowing that there's probably in the last 3 months, they used what would have been predicted to be 6 months of testing. So I think we're right now at probably about twice what the state predicted. And so I think they're doing what they can to correct that so that we have ongoing tests. We got kind of close here this week to not having enough tests, and then the state, through Bob Weaver and all the influence that he could wield from the health department, many calls, and he got that unstuck, and they delivered 2,400 tests to us here just a couple of days ago. So we're still in operation. He turned around and then made a second order so we make sure we don't get to that point where we're going to run out of test kits. So I think that's kind of the update. The weather's so far been cooperative, but winter's coming, and we'll see how snow affects the turnout. So I think that's my update, Mayor.
All right, Kurt, I appreciate all you're doing, all the overtime, all the extras that you're doing to try and meet this heavy demand. So thank you. We'll be back. We'll certainly have you back to continue to update us, and appreciate your call. Thank you.
Sure. Thank you very much.
All right.
Bye.
You know, again, I'd be remiss to not talk about how well I think we've coordinated with the county this morning, with the county health department, with Bowen Center, with all of our partners. Talked to the commissioners this week. They're certainly all on board, understanding the severity and difficulties that we face, and are certainly, I'm sure, studying other options as well. So again, all I can certainly stress is the importance of staying safe, wearing masks, washing hands, keeping your social distances. We certainly don't want to go back to the shutdown. The governor talked about that Wednesday, and his plea was that all of these restrictions and precautions that we're asking you to take right now are hopefully to prevent having to go back to where we were. And I feel strong that this community will respond to that, and I feel very strong that we'll come out of this, and hopefully we'll have some good news with the vaccine and some of the other drugs that are coming forward to start to put a little bit of control on this issue. So, Dr. Remington, any more final comments here?
No, I just hearing Mr. Carlson's voice, just greatly appreciate the partnerships that our health department has had in the community, and the Bowen Health Center has been just tremendous. And so thanks to Kurt for working all the details out and trying to meet an unprecedented testing demand. And for you, for having this venue for us, and the county commissioners supporting the mission of our local health department. And we need all of that. And this community knows how to do this, and we know how to be good citizens, good partners, and we'll get through this. This thing will not last forever. It is a marathon, though, so we need strong legs and strong will. Thank you.
I did get a few more questions, and I feel that we should address those. The next one is about First Friday in a few weeks. Has that been canceled? The Twinkle Light Parade, park lighting, etc. What about other community events in Warsaw County? Well, as you know, the governor put a restriction back down to 50, the number of that could be at a gathering, both outdoors and indoors. And if we unfortunately move to red, that goes down to 25. Those events still could be approved through the Department of Health, but I think the likelihood of those types of events being approved would probably be impacted if in a negative way if we hit into the red. We have not made a final decision on First Friday, but I've had discussions, and we will be making a firm decision probably early next week. This all has come up so quickly. I haven't had a chance to meet with the organizers, but I feel somewhat that all those events are in jeopardy. Dan Spalding had a question. I think this is to you, Dr. Remington. Are we seeing the impact of fall break where school officials heard reports of large gatherings? Any truth to that.
Perhaps, Dan. It seems like we've seen some surges in the months previous after holiday breaks and people getting together and then coming back. So anything that mixes the community social pot, I think, applies to this COVID pandemic. I don't know that it's easy to point to one thing with this surge of the last 3 weeks. We're concerned with the Thanksgiving holiday and the Christmas holiday to come, again, back to people leaving their work or school domains and jumping into a different mixing bowl. And hopefully we won't see even greater surging after those holiday events. And thus, these voices you hear now, and please to rethink your gatherings with family this year so that you may have robust gatherings next year and have the people around the table that you had hoped to have around the table. Thanks.
All right, thank you. Mike, any final comments?
I like what I'm hearing. You know, the new CDC guidelines are telling us that masks protect both the wearer as well as anyone around them. And I would just ask people, you know, please be a good citizen and wear your mask. Exercise your right to wear a mask.
Mike, and I'm glad you brought that up because I did have Stacy put the link to that literature search that the CDC released this week. It'll be on our website and our Facebook page. And again, that's the CDC bulletin. I think if you go to CDC mask study, it'll pop up. But if you need the link, it's on our Facebook page and our city website on the CDC mask literature search. So thank you. All right. We will go to not this coming Wednesday, but the following Wednesday, the day before Thanksgiving, for our next press conference. If conditions warrant, we may come back again next week. But again, I would say for now, our next press conference will be a week from Wednesday, unless we need to come back if conditions change. So I'll just check and make sure that no more questions have been asked. And it doesn't look like it. All right, so thank you very much. Appreciate it.